I told her I would cry. Okay, hello, my name is Lauren Zwinger, and this is Gina Grosso, and we're going to be graduates from the full-time cohort here at NAU. And we thought it might be a good idea to just shed some light on the field of speech-language pathology, since you're all about to have an official...
We're all friends now, we've all cried a little. Raise your hand if you're still a little bit confused about what a speech-language pathologist actually does. Come on, get them up there, Lauren. No. All right, as you can see, there is still a lot of confusion about what are surrounding our field. And just a warning, a Google search isn't really going to help because SLP actually stands for a lot of different things.
School lunch program,
Speed limit point,
Sri Lanka police,
and a seated leg press.
So, with much confusion surrounding our field, we can only imagine the questions you were asked as fathers, mothers, sisters, brothers, wives, husbands, and friends of future SLPs.
So, according to the American Speech Language and Hearing Association, or what we call ASHA, a speech-language pathologist is responsible for the diagnosis, prognosis, prescription, and remediation of speech, language, and swallowing disorders.
The overall objective of our speech-language pathology services is to optimize individuals' ability to communicate and swallow, thereby improving their quality of life.
And that's a great definition and all, but Lauren and I were thinking how many people can truly understand what that means. So we thought we'd take just a few minutes to go over a couple of the areas and just a few of the responsibilities that SLPs have in their scope of practice that we found on the ASHA website. Ready? Ready. Speech-language pathologists address typical and atypical communication and swallowing in the following areas:
Articulation,
resonance,
voice,
fluency,
language,
dysphagia,
oral rehab,
and cognition.
Speech-language pathologists provide clinical services that include the following:
Prevention,
screening,
assessment,
evaluation,
consultation,
counseling,
collaboration,
diagnosis,
treatment,
documentation,
education,
and referral.
Speech-language pathologists work with pediatric and adult clients with a wide variety of disorders and diagnoses, including, but definitely not limited to,
Neonate,
autism,
dyslexia,
dysfluency,
respiratory compromises,
tracheostomy,
hearing loss,
deafness,
cleft lip and palate,
oral motor dysfunction,
vocal fold pathologies,
aphasia,
stroke,
traumatic brain injury,
cerebral palsy,
Down syndrome,
dementia,
schizophrenia,
Parkinson's disease,
and genetic disorders. There's more.
Speech-language pathologists provide services in a wide variety of settings, which may include, but are not exclusive to,
Public schools,
private schools,
preschools,
hospitals,
long-term care facilities,
clinics,
private practice settings,
universities,
community residences,
state agencies,
federal agencies,
correctional institutions,
research facilities,
and corporate settings.
You know, we could go on and on and on and read the rest of this information, but the bottom line is our field is extensive and varied with opportunities to fit each of our graduates' individual interests and, importantly, our strengths.
And as you've probably heard, graduate school, well, from your graduates, that graduate school is hard. It's been really, really hard for all of us. But it has also been one of the most amazing experiences of our lives.
Whether we did the program full-time in 2 years or part-time over 3 summers and 4 academic years, graduate school was a time to learn and grow as future speech-language pathologists and as people as well. Our cohort had 3 weddings, and we even have a baby on the way. We've hiked mountains, we've danced salsa, and we've made lasting friendships.
We survived Tequila Sunrise, enjoyed First Fridays together, and even traveled to the Windy City. The other Windy City over there.
We played kickball, we visited Sedona, and we celebrated birthdays. And we also have taken the next steps in our lives.
And as students, our time at NAU has provided each of us with the education and skill set needed to be successful in the field of speech-language pathology. We learned about audiology from Dr. Skelton,
Cognition and dysphagia from Dr. Asaki,
neurology and motor speech from Dr. Farinella,
phonology and articulation from Dr. Sosa,
fluency and voice from Dr. King,
literacy and language from Dr. Harmon,
and research design from Dr. Stewart.
We were supported by our department chair, Dr. Lindstedt, our NAU clinic supervisor, Cindy Farrell, and not to mention Joanne, Sarah, Terry, Donna, Patty, and Athena, who keep both the clinic and program offices afloat. We would be seriously lost without them.
Our department also employs numerous outside supervisors to provide us with as many types of experiences as possible. At this time, we would like our professors, office staff, administrative assistants, and supervisors to please stand up to be recognized for your contributions and success in our graduate school.
Students will be hooded with their masters in clinical speech-language pathology. On a low average, and I'm talking an extremely low average, an SLP will see approximately 12 clients a day.
That means combined, our students here today will see 840 clients each day.
That's 4,200 clients a week.
16,800 a month,
and 218,400 clients each year. Lauren and I cannot be more honored to stand before you today as representatives of Northern Arizona University's Department of Communication Sciences and Disorders full-time cohort of 2014.
To everyone in our cohort,
don't do it.
Thank you for the memories, the laughs, the squabbles, and the hours and hours we spent together on the 3rd floor in the spa at the top of what has to be the worst set of stairs in the world.
It has truly been a pleasure to work with and get to know each of you. And also, thanks for putting up with all my nicknames, especially you, Schmitzel, Drew Haha, T-Bone, Marmer, Scony, Rochi, and of course, my ducky.